Labor care guide or partogram? Which one is easier? Labor care guide is much easier. Hi, I'm Dr. Puuja Arora, your study buddy, your mentor from Just MRCOG. Let's have a quick recap of labor care guide and let's make it easy for everyone. First, 4-hourly monitoring. That is for vitals, temperature, urine for protein, acetone, vaginal examination, and abdominal examination for descent. For contraction and duration, first 1 hour, first stage of labor it's 30 minutes, second stage of labor it's 15 minutes. But for fetal heart rate, it's first stage of labor 30 minutes and second stage of labor it's 5 minutes. This is the very first thing which you need to remember. Now coming for vitals. Systolic blood pressure range is 80 to 139. So if it is less than 80 or more than 139, that's an alert. Diastolic blood pressure, if it is 90 or more than that, that's an alert. Pulse rate has to be between 60 to 119. If it is less than 60 or more than 119 per minute, then it's an alert. We should check full 1 minute. Cervical dilatation. One should not start at contraction. One should take a proper verbal consent. Aseptic precaution. How to remember this? It's 5, 6, 7, 8, 9 because active stage of labor starts from 5 centimeter as per labor care guide and 10 centimeter is already fully dilated. Now the tip or trick is 5, 6, 6, 5. 5 centimeter 6 hours, 6 centimeter 5 hours. How to remember whether it's 5, 6 first or 6, 5 first? Because active stage starts from 5, so it is 5, 6 which is first. So 5, 6, 6, 5. Now 7, 8 and 9. 9 centimeters 2 hours. Then go retrospective and increase half hour. 8 centimeter 2.5. 7 centimeter 3 hours. So let's do a quick revision. 5 centimeter 6 hours, 6 centimeters 5 hours, 7 centimeters 3 hours, 8 centimeter 2.5 hours, 9 centimeters 2 hours. Now coming to abdominal examination for descent. It is 5 by 5 to 0.5 above symphysis pubis. 4 hourly in first stage and second stage as per situation. 5 by 5 when head is completely palpable above symphysis pubis. 0.5 means 0 by 5 means you are not able to palpate head above symphysis pubis. It means it's fully engaged and reached to 0 station, that is ischial spine. Now coming to contraction and duration. Normal contraction 3 to 5. Any deviation from this is an alert. We should check it properly for 10 minutes. 30 minutes in first stage, 15 minutes in second stage. Duration 20 to 60 seconds is the duration for each contraction, which is normal. Any deviation from 20 to 60 seconds is an alert. If it is more than 5 in 10 minutes or it's a continuous contraction, probably it's a case of obstructed labor or hyperstimulation. So that will be an alert. Now coming to fetal heart rate. Fetal heart rate in first stage 30 minutes and second stage 5 minutes. So what is the only confusing point? Contraction duration and fetal heart rate. Contraction duration 13, 15 and fetal heart rate 35. You should check complete 1 minute and the criteria is 110 to 159. So 110 to 159 is normal. If it is less than 110 or if it is 160 or more. So if it is less than 110 or if it is 160 or more, then it is an alert. In second stage of labor, as you are checking every 5 minutes and say sometime it is like fetal bradycardia or some deceleration, so you will check it for 3 times in 15 minutes obviously at 5 minutes interval, and whatever is the significant in that particular time frame, that is going to be your diagnosis and an alert sign. Always, whenever you check fetal heart rate, make sure that 30 seconds you are checking in contraction and 30 seconds when uterus is relaxed. So it is going to be 1 hour. Temperature is 35 to 37.4 degrees Celsius, 35 to 37.4 degrees Celsius. Any deviation from this is an alert. There are certain other points which labor care guide included in labor guide, that presence of companion, accepting oral fluids, that is good. If not accepting, that is an alert. IV fluids, analgesia, any other medication. These are all points which they have included. Alert if urine protein acetone 2 plus, if blood is in liquor, if meconium 3 plus, that is thick meconium. So it is non-significant, is thin and thick. So when it is thick 3, then it is significant 1. There is one other change which is still having little ambiguity. As per the labor care guide chart, when primi is 3 hours or more than that in second stage of labor, or multi 2 hours or more than that in second stage of labor, that is an alert. Earlier it was 2 hours and 1 hour. And with epidural, earlier it was 3 hours for primi and 2 hours for multi. It is given in labor care guide as 3 hours for primi and 2 hours for multi. They have not given any clear cut idea whether they have included epidural in this or not. But as they are recommending epidural, probably they are mentioning it with epidural. So in SD, better if you want to mention it and you want to make it clear, you can tell it to your examiner that as for labor care guide, it's 3 for primi, is 2 for this thing, for multi, but as the previous NICE guideline, 2 plus 1 epidural primi, 1 plus 1 multi with epidural. And how to plot cervical dilatation. The cervical dilatation section, in the vertical axis, putting mark of X for the cervical dilatation and timing on the horizontal axis. For descent of the head, it is going to be O, and it is on the vertical axis, and horizontal axis again timing. When patient in the second stage of the labor and pushing starts, so in cervical dilatation, you will mark as P. Again, I repeat, in cervical dilatation axis, you will mark as P. I think this is basic all about labor care guide. Once you understand that, you can easily incorporate this in any task if they give. Just suppose if they have given a task that patient has been admitted 2 hours back or 4 hours back, and this was the finding. And now what you are going to do? So definitely as per the time interval you are going to offer, whether it's a time for fetal heart rate checking or uterine contraction or descent or temperature. If you know the criteria, you can mention that. Ideally, there should be further fetal heart rate monitoring because it's first stage of labor. It should be every half an hour. So we'll do that immediately. Right? So contraction every half an hour you have to check. So if they have given any finding 1 hour before, right? So then you are going to mention about checking the contraction and duration and the fetal heart rate monitoring and the other criteria as well. And you have to mention that in chart. They will give you chart. The chart will be in front of you. You have to just fill that. And if you remember alert sign and the normal sign, it's very easy for you to fill labor care guide. And trust me on that. It's very, very easy. Keep studying. Take care. Bye-bye.